Chapter 55, Nutritional Supplements. These are dietary products used to provide nutritional support, and they can be given in a variety of ways. They vary in the amounts and complexity of the carbohydrates, protein, and fat that they deliver. They also vary in terms of the electrolytes, the vitamins, the minerals, and the osmolality. These are for people who cannot eat or who cannot eat enough for adequate nutrition. The two main modalities are, first, enteral nutrition. These are foods that are provided through the GI tract. Maybe it's something they just drink. Maybe it's a tube put down through their nose or their mouth into their stomach. Maybe it's a tube that's inserted directly through the abdomen into some place in the GI tract. But these things are delivered directly to the GI tract. The second modality is parenteral nutrition, and the nutrients are delivered into the circulation via an IV solution. Enteral nutrition, the provision of food or nutrients through the GI tract. Oral consumption is the most common and least invasive route. So we give people things to drink. This is the Ensure that people drink, or the Complete, or the Glucerna. However, feeding tubes may be used. Feeding tubes are used for people who have some kind of abnormality with the tract itself, the GI tract, or something's wrong with peristalsis, or things are changed because of surgery, either their anatomy or the way the GI tract is working. It's also used for people who are semi-conscious or unconscious, because you can't eat by mouth that way safely, you choke. And sometimes it's used for people who have an impaired digestive capacity. Yes, they can digest some, they just can't digest all the way. They provide the basic building blocks for anabolism. They supply complete dietary needs through the GI tract, through the mouth, or by a feeding tube. Some of these formulas are broken down into their very elemental states. The components are broken down as much as possible so they're very simple to digest. Some provide a higher level of calories and or other nutrients than are found in food. This is things like Complete or Ensure. Some provide very specific things like amino acids. And some are designed for people with glucose intolerance. That's the Glucerna. Two of the problems with enteral nutrition are, first, aspiration. Now this is a life-threatening one. People who are receiving tube feedings because they are semi-conscious or unconscious, or if they're getting it all the time and they're lying down, just plain old gravity. If they have a little bit of what you and I would consider just plain old belching or some reflux, this content can go down into the stomach, into the lungs, and cause pneumonia. The second common problem with these is sometimes people have an intolerance. They're just so hyperosmolar that they have problems with bloating or diarrhea. Diarrhea is a fairly common problem with these. Now let's move to parenteral nutrition. These are totally digested nutrients that are given intravenously, directly into the circulatory system. We totally bypass the GI system, so that these things don't need to be absorbed or metabolized, and then they don't need to be eliminated. Some people call this total parenteral nutrition, TPN, or hyperalimentation. Formulations are going to vary according to what the individual needs. Maybe they're big on amino acids or carbohydrates or lipids or some sort of trace elements. We give this either peripherally through a peripheral vein. That would typically be someplace in the arm. That's commonly. It's for temporary use, less than 2 weeks. And we run it along with a dextrose concentration that's less than 10%. Alternately, this parenteral nutrition can be delivered centrally. That's through a central line. It's for long-term use. That's over 2 weeks. And the dextrose concentrations of the solutions may be as high as 10 to 50%. Peripheral TPN is used to provide nutrition to patients who need more nutrients than their present oral intake can provide. The problem with peripheral TPN? Phlebitis. Phlebitis is a big one, and it can be devastating. It can lead to the loss of a limb. So you have to be just compulsive about checking the site for this one. And the second common, well, it's not that common, but it's devastating enough, is fluid overload. Central TPN is delivered through a large central vein, such as the subclavian or the internal jugular, and it's for long-term use, that is more than 2 weeks. Disadvantages are risks associated with central line insertion, use, and maintenance. And there's a higher risk for infection, catheter-induced trauma, and metabolic alterations. The most common adverse effects for central TPN are those that are concerned with infection and catheter-induced trauma. But these people also have a greater chance for hyperglycemia due to the larger volume and more concentrated volume of solution that's given. So what are we going to do for these ladies and gentlemen? Nutritional assessment, absolutely. And a registered dietitian should be part of the planning. If we are providing enteral nutrition, we need to, first of all, follow all policies. We need to follow them in terms of administration, checking placement of the tube, checking residual. That means when you come back to give a feeding, you check what's left in the stomach from the previous one, and flushing of tubes. Most enteral feedings are started slowly, and the rate is gradually increased. We're going to be watching for signs of lactose intolerance. Parenteral nutrition, the nursing implications. Again, we are following the policies and procedures, absolutely. We are making sure we're following the guidelines for how do we take care of TPN lines. We're watching their temperature and reporting increases immediately. We're watching their blood sugar. We're looking for hyperglycemia and hypoglycemia. If we suddenly stop delivering this fluid, this nutrition, people tend to drop their blood sugar and go into a hypoglycemic reaction. So, if you have to stop the fluid, give a 5 to 10% glucose solution infusion to them. Monitor for fluid overload. Monitor daily weights, intake, output. Monitor for therapeutic responses to the nutritional supplement, and this is both enteral and parenteral. We're checking to see, are they feeling better? Is their energy better? Or what's their weight doing? What's their INO doing? What's their labs doing? And as always, we're looking for adverse responses.